Corticosteroids exert their effects through both genomic and non-genomic mechanisms, and understanding the differences between them is important for appreciating how these drugs act. 1. Genomic mechanism. Time frame. This is a slower process, typically taking hours to days. Process. Corticosteroids bind to intracellular glucocorticoid receptors, forming a receptor steroid complex. This complex translocates to the nucleus, where it binds to glucocorticoid response elements, GREs, on DNA. This interaction modulates the transcription of target genes, either increasing or decreasing the production of specific proteins, e.g., anti-inflammatory proteins. Effect. The genomic pathway leads to long-term changes in cellular function, especially in controlling inflammation, immune response, and metabolism. Examples include increased production of annexin 1, an anti-inflammatory protein, or decreased synthesis of pro-inflammatory cytokines like IL-1 and TNF-alpha. 2. Non-genomic mechanism. Time frame. This is a much faster process, occurring in minutes. Process. Corticosteroids act membrane-bound receptors or by directly interacting with cellular membranes. These interactions influence signaling pathways and ion channels, modulating cellular activity without altering gene transcription. Effect. Non-genomic actions include rapid anti-inflammatory effects, modulation of immune cell activity, and changes in cell membrane permeability. These effects help in immediate responses, such as reducing acute inflammation, and do not depend on protein synthesis. In summary, the genomic mechanism involves changes in gene expression and takes longer to manifest, while the non-genomic mechanism involves rapid, direct actions on cells that lead to quicker effects. The genomic and non-genomic mechanisms of corticosteroids require different approaches in terms of indications, dosing, types of steroids, and precautions. Here's a breakdown for both mechanisms. Genomic mechanism. Indications: chronic inflammatory and autoimmune diseases, rheumatoid arthritis, systemic lupus erythematosus, SLE, inflammatory bowel disease, e.g. Crohn's disease, ulcerative colitis, chronic asthma, polymyalgia rheumatica, vasculitis. Doses: prednisone, prednisolone, 5 to 60 milligrams per day, depending on the condition's severity, maintenance versus flare. Dexamethasone, 0.5 to 10 milligrams per day for severe inflammatory diseases. Hydrocortisone, 20 to 80 milligrams per day, often used for adrenal insufficiency or less severe cases. Doses are generally lower than those used for non-genomic effects, as the genomic pathway is involved in long-term suppression of immune responses and inflammation. Tapering doses is important to avoid adrenal insufficiency. Types of steroids: prednisone, prednisolone, commonly used for chronic inflammatory diseases. Dexamethasone, often used in more severe or refractory cases due to its high potency. Methylprednisolone, used in pulse therapy for acute flares, e.g. 1-gum IV in severe lupus flare. Precautions: chronic use risks: osteoporosis, diabetes, weight gain, hypertension, glaucoma, cataracts. Infection risk: immunosuppression increases susceptibility to infections. Adrenal suppression: long-term use suppresses adrenal function, requiring slow tapering of the dose. Gastrointestinal risk: ulcer formation, especially when combined with NSAIDs. Monitoring: bone density scans, blood sugar levels, blood pressure, and eye exams are recommended during long-term use. Non-genomic mechanism. Indications: acute and severe inflammatory reactions, acute asthma exacerbations, anaphylaxis or severe allergic reactions, acute flares of autoimmune conditions, e.g. lupus nephritis, acute vasculitis, post-transplant rejection, severe septic shock in specific cases. Doses: methylprednisolone, IV pulse therapy, 500 to 1,000 milligrams per day for 1 to 3 days, often used in life-threatening situations, e.g. lupus nephritis or severe vasculitis. Dexamethasone, 4 to 16 milligrams IV for rapid anti-inflammatory or immunosuppressive effects, e.g. severe asthma attack or acute allergic reactions. Hydrocortisone, 100 to 500 milligrams IV for rapid action in acute adrenal insufficiency or septic shock. Higher doses are often required for immediate effects, particularly when addressing acute inflammatory states. Types of steroids: methylprednisolone, common for IV pulse therapy due to its potent and rapid action. Dexamethasone, frequently used for acute situations requiring fast intervention. Hydrocortisone, preferred in critical care settings such as septic shock or adrenal crisis due to its mineralocorticoid and glucocorticoid effects. Precautions: short-term side effects, hyperglycemia, mood swings, fluid retention, electrolyte imbalances, e.g. hypokalemia, and elevated blood pressure. Gastrointestinal protection: higher doses can increase the risk of gastrointestinal bleeding, so proton pump inhibitors, PPIs, or H2 blockers are often co-prescribed. Infection risk: increased risk of infection, especially at higher doses. Electrolyte monitoring, particularly with high doses of hydrocortisone, which has mineralocorticoid effects that can lead to fluid retention and hypokalemia. Summary of dosing and precautions. Mechanism, indications, doses, steroid types, precautions, Wilson, DEXA. Plenty of dosing and precautions. Genomic, chronic inflammatory autoimmune conditions, 5 to 60 milligrams per day. 0.5 to 10 milligrams a day, DEXA. Prednisone, dexamethasone, osteoporosis, infection risk, adrenal suppression, GI issues. Non-genomic, acute severe inflammatory reactions, transplant rejection, 500 to 1,000 milligram IV, methylpred, 4 to 16 milligram DEXA. Methylprednisolone, dexamethasone, hyperglycemia, fluid retention, hypokalemia, rapid infection risk. In general, corticosteroids used for their genomic effects involve chronic management, while non-genomic actions are used for acute, life-threatening situations requiring rapid intervention.
In this lecture, there is wrong information because methylprednisolone is not used at all for genomic indication. It is for non-genomic. It is rapid action. Pulse steroid here, which is mentioned in the genomic, is written by mistake by ChatGPT.